So this is a phase 1/2 trial of Binimetinib in combination with a Pembrolizumab. So Binimetinib is a MEK inhibitor based on the previous preclinical and clinical study. Study shown that activation of the MAP kinase pathway is associated with the reduction in the tumor infiltrating lymphocytes, and the combination of MEK inhibitor and the anti-PD-1 in the animal model was synergistic, and it's increased response rate. So this is the reason why we conducted the clinical trial with the combination in patients with metastatic triple negative breast cancer. So what we found was that in the phase 1 trial, the Binimetinib dose, starting at the dose level of 0, which is the 45 milligram BID, we ran into dose-limiting toxicity in 2 out of 4 patients. Patients experienced significant increase in liver function tests and also intractable nausea despite anti-emetic therapy requiring hospitalization, and that's resulted in the dose reduction. We had to went down to the dose level -1. With the dose level -1, Binimetinib dose was reduced to 30 milligram twice daily, and that's much better tolerated, and that's what the dose that we use in the phase 2 study. We enrolled a total of 22 patients in the trial. As I mentioned earlier, some patients were treated in the dose level 0, patients that were treated in dose level -1, which was the dose that choose for the phase 2 study, were considered as evaluable patients for the response rate in the subsequent phase 2 study. And what we found was that the objective response rate was about 29.4%. Clinical benefit rate was about 35%. But on the other hand, if you look at the patients that had liver metastases, based on the previous preclinical study, which shown that patients with liver metastases had significant reduction in the CD8 T cell due to the sequestration of the CD8 in the peripheral blood, due to macrophage, bone marrow-derived macrophage cells, and preclinical study showed that those patients actually might not respond quite well to immune checkpoint inhibitor. We did the subset analysis in our trial and found that patients that had liver metastases, 5 of them did not have any objective response at all. And then when you take off these patients who had liver metastases, the objective response rate in patients without liver metastases went up to 55% with a clinical benefit rate of 66.6%. So we're hoping to conduct a future clinical trial perhaps in this group of patients. The median duration of response is quite long. It has not been reached, and 60% of patients, so 3 out of 5 patients, had that responded, had a duration of response greater than 12 months, and some of them still had ongoing response over 32 months. So that the trial that we did, and we're quite excited about the result.